When your performance fails in bed, most men immediately blame age, but age is only part of the story. Often the real culprits are poor pelvic circulation, prostate congestion, chronic inflammation, and sleep loss, things you can influence with simple, consistent habits. I'm Dr. Julia Morgan, a board-certified urologist, and today I want to walk you through 5 practical habits that can help improve blood flow, reduce prostate-related irritation, balance hormones, and ultimately support better performance. These are not miracle fixes, but they are habits men can start today that may make a measurable difference over weeks to months. Before I go on, where are you watching from, and which of these 5 habits would you be most willing to try? Leave a quick comment now. I read them and it helps me shape future content. To make sense of these habits, first a short, plain explanation of how the anatomy and physiology connect to sexual function. Think of the bladder like a water balloon, the urethra like a straw running through that balloon, and the prostate like a soft collar sitting around the straw. When the prostate is inflamed, enlarged, or congested, that collar presses tighter on the straw. Blood flow is the pump that makes an erection possible. Tiny arteries in the penis need to fill quickly and fully. Anything that thickens blood, narrows vessels, or increases tissue swelling can reduce that flow. Nitric oxide, a molecule your body produces, helps those blood vessels relax and open. Inflammation and poor metabolic health blunt that process. So when I talk about circulation, inflammation, prostate congestion, and hormones, I'm talking about the physical systems that make performance possible. Now let's get into the 5 habits. For each one, I'll explain why it matters for in-bed performance, give concrete actions you can start immediately, describe the timeline you might expect, and share a brief patient vignette to bring it to life. Habit 1. Strategic hydration. Why it matters. Blood that's slightly thicker moves less efficiently. Steady, appropriate hydration improves blood viscosity, supports kidney and bladder function, and reduces the local irritation that can make the prostate feel congested. When your tissues are well hydrated, they tolerate friction and stress better, and blood can deliver oxygen and hormones more effectively, all important for sexual response. What to do today? Sip fluid steadily through the day rather than gulping large amounts all at once. A practical pattern men find useful is having a small glass every 30-45 minutes during waking hours. Taper your drinking in the 2 hours before bed to reduce nighttime awakenings. Be mindful of beverages high in caffeine and alcohol late in the day. Both can disrupt sleep and blunt nocturnal blood flow. Aim mainly for plain water. If you tolerate it, a little electrolyte in the evening can help avoid overnight cramping without driving excess urine.
Timeline and expectations. Improvements in daytime comfort and fewer nocturnal awakenings can appear within a week. Effects on overall circulation and perceived performance are often noticed in 2 to 6 weeks as hydration becomes consistent. Patient vignette. Alan, 68, told me he'd been drinking heavily at dinner, then waking multiple times at night. He switched to steady sipping and cut back on late alcohol. Within 3 weeks, he reported fewer interruptions to sleep and said that for the first time in months, he felt more reliable during intimate moments, not because of a pill, but because he wasn't waking up dehydrated and anxious. Mini transition. Hydration sets the stage, but movement keeps the blood moving. That's the next habit. Habit 2. Light walking after meals. Why it matters. A short walk after eating improves pelvic and systemic circulation, helps stabilize blood sugar, and reduces the inflammatory spike that follows large or processed meals. All that matters for penile blood flow and for the small vessels that feed the erectile tissue. Walking also supports endothelial function, the health of the blood vessel lining that produces nitric oxide. What to do today? After lunch and dinner, take a 10 to 15-minute easy walk. It should feel gentle, not a jog, just enough to get your heart rate up modestly and to engage the pelvic muscles and blood vessels. If you can, remove shoes and walk on grass for a couple minutes to add sensory relaxation. If weather or mobility are an issue, stand and march in place for 10 minutes or do gentle leg swings and hip circles to stimulate circulation. Timeline and expectations. Many men notice improved digestion and less bloating within days. Changes in pelvic circulation and sexual response may become noticeable after 2 to 4 weeks of consistent post-meal walking. Patient vignette. Robert, 71, was retired and spent long afternoons seated at the dining table. He began a routine of a brisk 12-minute walk after dinner. Within a month, he reported reduced post-meal fatigue, fewer episodes of urgency at night, and a modest but meaningful improvement in firmness during sexual activity. He described a boost in confidence that made intimate moments less anxiety-filled. Mini transition. Movement helps the pump. Regular sexual activity helps the prostate and circulation in its own way. Habit 3. Regular sexual activity or natural release. Why it matters. Regular sexual activity, partnered sex or masturbation, helps clear prostate fluid and reduces the sensation of congestion that can build up in glandular tissue. Frequent ejaculation is associated in some studies with lower prostate inflammation markers and may help maintain healthy local tissue dynamics. Beyond the mechanical clearing, sexual activity boosts nitric oxide production, supports hormone signaling, and reinforces psychological confidence, all contributing to better performance.
What to do today? Normalize comfortable, low-pressure intimacy. If partnered sex isn't occurring regularly, encourage natural release in a way that feels right for you. There's no universal right frequency. The goal is consistency without creating stress. If anxiety is a barrier, aim for relaxed, pressure-free encounters and open communication with your partner. If self-release is your choice, make it a stress-free part of routine. Avoid turning frequency into a performance metric, and that as maintenance. Timeline and expectations. Some men feel relief from prostate discomfort within days to a couple of weeks. Improvements in confidence and sexual performance may appear within 2 to 8 weeks as anxiety decreases and tissue dynamics normalize. Patient vignette. Mark, 67, had been avoiding intimacy because he feared underperforming. We talked about pressure and expectations, and he committed to relaxed, non-goal-oriented intimacy and to regular natural release when alone. Over 6 weeks, he described not only reduced pelvic discomfort, but a surprising increase in spontaneous desire and a calmer approach to encounters, which in turn improved his performance. Mini transition. Sexual activity helps clear and prime the system. Diet nourishes it. Habit 4. Strategic eating for vascular and prostate health. Why it matters. Diet affects inflammation, vascular health, and hormone balance. Foods rich in lycopene, zinc, omega-3s, and phytonutrients support vascular function and prostate health. Conversely, processed meats, high sugar, and fried foods increase inflammation and impair endothelial function, which reduces nitric oxide availability and narrows the window for reliable performance. What to do today? Build a simple stoplight plate. Half the plate, colorful vegetables. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts are especially helpful for hormone regulation. 1/4, lean protein, with zinc-rich options like pumpkin seeds, shellfish occasionally, or lean poultry. 1/4, whole grains or healthy starches. Add cooked tomato products. Cooked tomatoes and tomato sauce release more lycopene than raw. Include fatty fish twice a week for omega-3s. Cut down on processed meats, sugary drinks, and fried foods. Small, sustainable swaps, like adding a handful of pumpkin seeds to your salad 3 times a week, matter more than perfect diets. Timeline and expectations. Changes in inflammation and vascular markers can begin with weeks. Men commonly report improved erectile quality and energy in 4 to 12 weeks after consistent dietary changes. Patient vignette. George, 72, enjoyed deli meats and heavy breakfasts. He swapped a couple of meals each week for a Mediterranean-style plate, more fish, tomato-based sauce, and vegetables. After about 2 months, he noticed both fewer urinary irritations and firmer responses during sex. He told me he felt physically lighter and more confident.
Many transition. Diet and activity support circulation, but if you don't sleep, hormones and recovery suffer. Habit 5. Deep restorative sleep. Why it matters. Sleep is when the body restores hormones like testosterone and melatonin, reduces inflammation, and repairs endothelial function. Poor sleep reduces daytime testosterone, increases stress hormones, and worsens vascular responsiveness. Even mild chronic sleep loss is associated with lower reduced erectile function in population studies. What to do today? Optimize sleep hygiene. Aim for a cool, dark bedroom and a consistent sleep schedule, lights out and wake time roughly the same every day. Avoid screens for an hour before bed and stop heavy meals or caffeine at least 3 hours before sleep. If you wake at night for bathroom trips, combine this habit with the hydration strategy. Taper fluids before bed and use the 2-hour rule. If sleep apnea is suspected, loud snoring, daytime sleepiness, morning headaches, seek evaluation because treating sleep apnea can meaningfully improve sexual function and cardiovascular health. Timeline and expectations. Many men notice more energy and clearer morning erections within 2 to 6 weeks of improved sleep habits. Hormonal shifts and reductions in inflammation often follow with longer adherence. Patient vignette. A man I saw in clinic had been logging 5 hours a night and blamed age for low desire and inconsistent performance. We addressed sleep hygiene, tapered late drinks, and screened for sleep apnea. Within 6 weeks, his sleep lengthened, he felt more alert, and he reported a marked difference in nighttime responsiveness. Better sleep improved his mood and reduced anxiety, which in turn helped his intimate life. Addressing common objections and limits. It's important to be clear.
Erectile dysfunction is multifactorial. Vascular disease, neurological problems, certain medications, hormonal imbalances, depression, and relationship issues can all play a role. These 5 habits specifically target vascular health, inflammation, prostate congestion, and hormonal restoration. They can be powerful contributors to improvement, but they are not guaranteed cures. If you have sudden onset erectile problems, severe pain, blood in the urine, or rapid changes in urinary function, seek medical evaluation promptly. Likewise, if you have long-standing heart disease, are on multiple medications, or have significant metabolic disease, work closely with your clinician to tailor any lifestyle changes. A few practical tips to make these habits stick. Group them into routines. For example, after lunch, take your 10 to 15-minute walk, sip water throughout the afternoon, add pumpkin seeds to your afternoon snack, and aim to wind down screens an hour before bed. Small, consistent changes beat dramatic, unsustainable overhauls.
Track progress with simple measures: fewer nighttime awakenings, better morning erections, more confidence during intimacy, and a subjective sense of energy. Evidence and medical context. A number of respected institutions and studies connect circulation, inflammation, and lifestyle factors to prostate and sexual health. Large medical centers and epidemiological studies have shown links between vascular risk factors and erectile dysfunction. Lifestyle changes that improve endothelial function, including exercise, healthy eating, and sleep, are associated with improved sexual function in many men. Research on ejaculation frequency and prostate health suggests regular, natural release may be associated with lower prostate discomfort in some populations. The evidence supports a lifestyle-first approach for many men, while recognizing that targeted medical therapies and evaluations are necessary for specific causes. Practical timelines and realistic expectations. If you adopt these 5 habits consistently, a reasonable expectation is to see early signs of improvement within 2 to 6 weeks, fewer sleep disruptions, reduced pelvic discomfort, and improved confidence. More marked changes in erectile quality may appear after 6 to 12 weeks as vascular and hormonal systems adapt. For some men, lifestyle changes are enough to achieve meaningful, lasting improvement. For others, especially those with significant vascular disease, neurological conditions, or medication side effects, lifestyle work will be part of a combined plan that includes medical therapies. Safety and boundaries. Do not stop or adjust any prescribed medication without talking to your prescriber. If you have heart disease or significant mobility limitations, adapt activities like walking under clinical guidance. If you suspect sleep apnea or experience chest pain on exertion, seek medical care before changing exercise habits. Recap and final motivation. To recap briefly, these 5 habits: strategic hydration, light post-meal walking, regular sexual activity or natural release, strategic eating, and deep restorative sleep, all support pelvic circulation, reduce inflammation, and help balance the hormones and local prostate environment that are so important for in-bed performance. Small habits repeated daily create cumulative improvement. You don't have to accept poor performance as inevitable. This video is for educational purposes and does not replace personalized medical advice. If you have ongoing or severe problems with sexual performance or urinary symptoms, please consult your healthcare provider for evaluation and testing. These habits may help many men, but they are not a guaranteed cure. If this message helped, share it with a friend, father, or brother who might benefit. If you have a moment, subscribe for more practical, evidence-based tips on men's health. And again, tell me in the comments where you're watching from and which habit you'll try first.
Small choices add up. You have more control than you think.